So now there's a picture association part of the discussion. I call this the dessert. So I'm going to hold up a picture, and you kind of just describe what's going on here. I have a feeling we know who this is.
Yes, that is my father. That is shortly after he joined the faculty at the Howard University College of Dentistry.
Okay.
You know, I like to tell the story that if you cut me, I will bleed Howard blue.
Okay.
Because my dad went to undergraduate school at Howard University. He went to the dental school at Howard University. He taught on the faculty at Howard University College of Dentistry throughout. My mother went to what's called Freedman's Hospital School of Nursing, which is now the Howard University School of Nursing. They met on a ward when my dad had appendicitis, and she was the nurse taking care of him.
That's great.
My brother went to Howard University undergraduate school. Then he later went to Georgetown Medical School. And then I went to Howard University undergraduate school and Howard University Medical School. So the thing that was ingrained in us growing up, again, my dad in service and my mother because of her service, we were going to go to Howard in service to Howard to help people. And it started there with that picture.
Now here he is, later years.
Oh yes, that's my dad again. As he got older, he had been in the Air Force.
Wow.
He did all that. He did the Howard thing. He was just an interesting guy. Again, very inquisitive. He was a musician.
Really?
He was a photographer. He was a writer. He was a real Renaissance man.
How many years did he practice?
Oh, he
had to be a lot,
probably, you know, he never really went into the dental practice. He taught at the dental school.
Oh, I see. I follow you.
Yeah, so he did not get out there. I wish he did have a private practice, because if he did, and if he made a lot of money, I'd have gone into financial planning. I would not have gone into this stuff.
I got you. I love this picture. Little Wayne here.
Yeah, that is me, and that's my mother in her visiting nurse's outfit.
What year is that roughly?
Oh, that had to be 1954, I'd say.
Okay, I see.
Yeah, Mom was a public health nurse back in Washington, D.C., and that's what that outfit is, visiting nursing.
That's great.
That's funny.
And I love this one. Christmas of '65.
Yeah, that was a chemistry set that I had, because, again, I always had an interest in the sciences, believe it or not.
Okay.
The funny thing about that chemistry set, that actually had a piece of radium in it.
Really?
Yeah, radioactive material was in that chemistry set, because my dad and I made a radioactive cloud chamber.
Oh,
and
nice.
So
That's what everyone does when they're a kid.
Can you imagine now having a piece of radioactive material that people can get a hold of?
No.
Yeah, there you
Not
go.
happening.
That is
I
it.
love this picture. What's going on here?
That's one of the most important pictures that I have, and we keep at the house. That is my mother on your left.
Okay.
Again, as a visiting nurse, that young baby had a cleft palate. Mom is there helping the mother and how to care for that baby. But that is the picture to me. When I talk about service, that is the picture I think about. Service to others. How can I help other people? That is one of the things I got from my mama. That is the picture to me that brings it into focus.
Now, what's going on with this one?
This is a picture of my dad using an x-ray. He started the x-ray department there at Howard University College of Dentistry, and he was one of the founding members of the American Society of Rankinologists, of oral rankinologists, in other words, of x-ray dentists. Which is quite an accomplishment when you figure that he's an African American and you just didn't have people doing that sort of thing. So I'm very proud of that, because, again, that tells me, again, the excellence of performance. If you do a job well, people will recognize it. He later on became president of that organization.
Really?
Very proud of him for that.
I love this picture.
That is my favorite car. That was a Toyota Celica. I was in medical school, and I was all that and then some.
Yeah,
man.
I bet you were.
I was.
Is this where the arrogance came in? Is that the
you
era?
got it, man.
I can imagine that.
Well, yeah, that was it, man.
Check this out.
I'm
I don't know if he's going to be a professional actor or he's going to be a doctor here. I love this one.
That's the hair, man. And believe it or not, the hair is actually smaller there than what it had been previously.
Oh, wow.
I had real big hair back in those days.
On that note, here's your older brother, Reed, I believe.
Yeah, Reed.
Yeah.
Reed is interesting. See, the reason why Reed is important to me is he went to Georgetown, then he went to University of Pennsylvania as a resident, then he went to the Wharton School of Business on a fellowship. He was he was the Commissioner of Public Health, District of Columbia, then he was Vice President of March of Dimes, then he went on to be President of Charles Drew Medical Society, Charles Drew Medical School and Martin Luther King Hospital. Later on, Vice President of AMA, and then he was Chief Medical Officer and Senior Vice President of United Healthcare. He knows a lot. Yeah, that's my brother, man.
Yeah,
he's the bright one of the group.
Yeah, and then here you are looking all studly. I love this one.
That's it, man. What can you say, man? It's amazing when you do a little makeup and backlighting.
Yeah, I hear you, man. It's amazing what it'll do. Here you are, patrol guard. I love it.
Yeah, yeah, that was me. As I think I was about 4th grade. I was patrol. You know, we used to actually in our neighborhood, we actually would guard little kids to make sure they got to school safely. I was about 5 blocks away from the school. I eventually became the captain of patrols as a 6th grader.
Yeah.
Leadership, I guess. Huh?
I love this one. I nicknamed this the 3 wise men right here. I love
Yeah,
this picture.
that is one of the great pictures. That's one of the few where you have us all together, believe it or not. So that's me, my dad, and my brother. And that was probably about just before my dad retired from the dental school.
Okay, that's gotcha. And I think you mentioned this doctor earlier.
Oh, yes, that is Dr. LaFall. Dr. LaFall became the first African-American who was president of the American College of Surgeons.
Wow.
And he was just a brilliant surgical oncologist, brilliant man. You know, he was just one of the most delicate, kind people, never raised his voice, but always got his point across, treated everybody with respect.
I love it. Looks like you're getting an award here.
Oh, yeah, that was at the most recent Kentucky Medical Association. They were honoring some work I've done in the community,
That's
and
great.
that was very special,
That's
very
great.
special.
Here you are with your lovely wife, Brenda.
Yeah, that's Brenda on the right-hand side. In the middle is Dr. Victor Fazio, who probably was the preeminent colon and rectal surgeon in the world. I mean,
Wow.
and I don't say that because I know, but he was the, you know, there's always the baddest dog.
Sure.
He was the baddest of the
was
bad
the bad
dog. He was it. That was the alpha dog. Brilliant man, very caring. To see this man who took care of kings and queens, literally, who would fly into Cleveland Clinic.
Really?
He took care of the highest people. He treated everybody the same, and I love that about him.
That's great.
Yeah.
That's good advice for young people watching this.
Dr.
Who's this?
Ian Lavery, he's the guy in the middle there. He is the most plain-spoken, simple guy. I never saw him rush. I never saw him hurry. I never saw him get frazzled.
Really?
No matter the complexity of the case, he was always composed. And that is one of the things I try to maintain when I'm in the operating room. Try to maintain my composure.
So tell us the backstory of how you started your program, Kentucky Health, how that came about.
Well, Kirk, I tell you, I recognize that African Americans had a poorer outcome for health things than any other member. Then I realized it's not just African Americans, it was people of lower socioeconomic groups. So the idea behind Kentucky Health was to how can we demystify healthcare and make it so that people understood health and what their role in caring for themselves. So they understood diseases, so they could be a better patient, if you will. And that's been the driving force behind that show. And that was one of my great shows. We've enjoyed that one. That was talking about pain, actually, which is one of these topics. How do you handle patients with pain without giving them too much medication? That was a wonderful